So I want to say, first of all, that for trauma, you don't need terribly traumatic events. So there's two ways to look at trauma. One is that bad things happen that shouldn't have. We've talked about those. But the other way to get traumatized is when good things happen that should have happened. So if the good things didn't happen that should have happened, sorry. So when you look at
the
that
trauma of omission.
Trauma of omission, where the parents, not that they didn't love you, not that they didn't do their best, but they were too stressed, traumatized, distracted themselves. Then you didn't get the kind of attention and the kind of acceptance and the kind of attuned being with that you needed. That itself can make you disconnect from yourself. The child needs that acceptance, that connection, that attunement. Our brain development requires it, our emotional development demands it, and when we don't get it, not because the parents don't love us, but simply because of their own issues, we can also suffer that disconnection. So that's what I call developmental trauma. This leads to the question of trauma, because it's one thing to recognize that all this originates in childhood pain. It's quite another to transform that pain. And for that, we have to understand what trauma is. So people often think that trauma is what happens to you. So trauma is a divorce when you were small and your parents fighting. Trauma is your mother's depression. Trauma is your father's alcoholism. Trauma is your parents' argumentation. Trauma is physical or sexual abuse or some loss. Those aren't the traumas. Those are traumatic. But the trauma is not what happens to you. The trauma is what happens inside you. And as a result of these traumatic events, what happens inside you is you get disconnected from your emotions, and you're disconnected from your body, and you have difficulty being in the present moment, and you develop a negative view of your world, and a negative view of yourself, and a defensive view of other people. And these perspectives keep showing up in your life in the present. And so the issue is not just to recognize what happened 10, 15, 30, however many years ago, but to actually recognize their manifestations in the present moment and to transcend them. And how do you do that? By reconnecting with yourself, by restoring the connection with your body primarily and with your emotions that you lost. And once you do, when you found these things again, then you have what we call recovery. Because what does it mean to recover something? It means to find it again. So what is it that people find when they recover? They find themselves. And the loss of self is the essence of trauma. So the real purpose of addiction treatment, mental health treatment, any kind of healing is reconnection.